So thank you so much for joining me. It's really a big deal that you're willing to come and share your story here because, I get to see this on a daily basis, people having like a life-changing response to TMS. And, I can speak till I'm blue in the face about how great the treatment is, but hearing it from people who've actually been through it just is a lot better to kind of give people a sense for what they may go through. So I'd like, first of all, to ask kind of for you to tell a little bit about what your story is and how you came to TMS and kind of how you were doing, things like that.
Well, I had suffered some significant losses. My children's father committed suicide. My daughter accidentally overdosed, and my mother passed away from complications of Parkinson's. And I thought I was doing fine. I had kept my job, bought a house, just kept on plugging along. 5 years later, well, I did a little therapy in there, of course, but 5 years later, I lost my job and I had a meltdown. I spent, I think, about 10 days in the hospital. They diagnosed me with severe depression, complicated bereavement, anxiety, PTSD, and agoraphobia. Now, during that 5 years, I was only leaving my house just for work and groceries. That was it. So I wasn't doing as well as I thought. And after I was in the hospital, that's when I found out how bad my depression was, because they told me I needed to get out of the house and started having my anxiety attacks, and it was crippling. And they put me on disability. Then I moved to Florida, hoping to be around my grandkids a little bit more, hoping that would help. And it helped somewhat. And then I became estranged from them because a lot of relationships don't survive this kind of depression. So tried some more therapy, was on a couple of medications, but I tended to not want to be on the medication because having a daughter that overdosed, I shied away from taking medication. So I went to therapy and I was like stuck in the mud and I couldn't get out of the mud. No matter how hard I tried, no matter how hard I tried convincing myself that I could do this. And my doctor, every time I went in to see my doctor, I would cry. So he said, try therapy one more time. So I went to therapy, and of course it was the same old thing. You just need to find something that's interesting to you to get you out of the house. It was getting out of the house that was the problem. So I was sitting on the couch one morning, and I saw a commercial, and I changed channels, and I saw another commercial, and I changed channels, and I saw another commercial. And I thought, okay, my insurance probably won't cover it, but it's worth a call. And I called and I spoke to Hillary, and she did an interview. And she said, let me check with your insurance. She called me back 2 days later, said she had gotten me approved. And it was very difficult at first just getting out of the house every day because you go for treatment every day. So my brain would try and tell me, you need to stay in the house. It's safe here. And I started treatment 3 days after Hillary got me approved. And I think I started feeling positive effects from it after like a week and a half. I didn't have sweaty palms when I drove. I didn't have the dripping sweat off the back of my neck from the anxiety. I started laughing more. I didn't have the ruminating thoughts of the same thing over and over and over again. So I was amazed. And then I got off my medication. And the worst thing now is I have to stay home.
Well, I'll tell you, that you did an excellent job telling your story right there, and it's just the same one I hear so often. Obviously, the details are a little different, but you had a depression, And no matter what kind of gets your brain into that way of functioning, you tried medications, you tried therapy, and nothing was working. And despite that, this treatment works in a different way. It's more targeted and it tends to sync back up the brain a little bit better than medications or therapy. You gave yourself another opportunity to have a treatment that worked. And so, obviously, this isn't a miracle cure for everyone. It's not going to fix every single person's depression, but for a lot of people who are very stuck, just the way that you described, it literally can be a life-changing treatment in just a few weeks. And so for me as a psychiatrist to see a story like yours over and over and over again, I wish everyone who had a response like you did could share it like you just did, because people need to hear this, because there are people out there right now who are stuck, who are feeling the way that you were feeling, who've tried medications and therapy, who probably qualify for this treatment through their insurance, who are not knowing about this treatment or don't know that it's an option. So I really appreciate you sharing your story. I'd like to know what was your experience. You mentioned a little bit about when you started, it was kind of tough to get out of the house. What would you say kind of overall from your perspective, what was it like to go through, the TMS treatment?
It's so painless. It's like, I described it, there's a little pad that's put on your head, and I described it like Woody Woodpecker tapping on your head. I could use my phone. I played games sometimes. Sometimes I sat and gabbed with your technicians during treatment. I don't know if that's allowed, but I did it. But you don't really feel anything except tapping on your head. It's nothing like, some people have said, is it like electric shock? No, it's nothing like that. I played my games on my phone and probably could have carried a conversation with somebody on the phone while I had the treatment. It's 19 minutes and you're done.
Yeah, and that's the important point I make to pretty much everyone who's starting. Most of the people who I see have never done TMS before, right? They've heard about it for the first time. They're coming in for treatment, and I try to reassure people by telling them, look, this is so safe that when doctors train on this treatment, they actually give each other the treatment to practice. So you got to think about it. We don't take Prozac to practice, right? It's
Right.
This treatment is safe.
That would be dangerous.
That I've actually sat in the chair because there's really no known toxicity with the treatment itself. And so, that's kind of reassuring, but it's really tough to kind of wrap your mind. Now that you've been through it, now that you've experienced it, you're like, oh yeah, the TMS, it's great, it's fine. But people who don't know about it, it's really hard to wrap your mind about really what this is, isn't it?
I want everybody to know that it's an option. Like you said, it may not work for everybody, but at the point where you're not getting results, what do you have to lose? And that's what I said to myself on the couch. I didn't do it without doing research, but what do you have to lose? You're getting nowhere the other way.
Really, with this, you don't have much to lose at all, because it's you have some time, and maybe if you have some co-pays with your insurance. But, statistically speaking, and this is the exciting thing, right? Statistically speaking, once you try a medicine, the chance that the next medicine is going to work for you is way lower than 75%. So if you're on a medicine and you're like, hey, let me go back to my doctor and get a different medicine, you're more likely to get a response to TMS than you are to that next medication. And that's the important thing that insurance companies are finally seeing, and that's why they're starting to approve it and reduce the number of medication trials that are needed.
The only thing I can say is it let me find my happy back. I was always a happy-go-lucky person. My daughter said to thank you because you gave her mom back. Chokes me up a little bit, but I feel like myself again. My friends are amazed at how different I am. I've always been an eternal optimist, and I had lost that. I was just in a fog, not participating in life, not existing. It was sad. It was really sad. And now I feel like my old self again.
And I'll tell you, that's the thing, is that I've been a psychiatrist for 15 years. Only now have I gotten to use this treatment finally in a way where we're treating, a large amount of people on a daily basis. And I just don't see the kind of results that you've got with medication. Medication is great. It works for a lot of people, but that life-changing results where it's like the light got flipped back on, like the light switch. It's just like
That's,
it's
yep,
boom. The brain is running again. We just don't
yep.
get that kind of results with medication. So this to me and a lot of my colleagues who do this, we really feel like this is a superior treatment. It's got less side effects, and we feel like this is really the future of psychiatry. So
I describe it, it's like somebody took the blind and pulled on it and it flipped up and I saw sunlight.
it's funny that one of the first patients I treated in 2010 with this, I came in one day and it looked like, someone had like a dusty light bulb and they had just cleaned it off. It was like literally looks like a light is off. And that's what we could see with you and everyone else who does great with the
Uh-huh.
treatment. They just walk in one day and it looks like they just came back from like a month-long vacation. Like just something has just, flipped in them and they're just feeling much better, relaxed.
It
And it's a
changed my life.
physical change. It's a physical change. So, thank you so much for joining us. I've got a couple little fun questions for you real quick. Are you ready?
Okay, I'm ready.
All right. Name one thing you're grateful for in this moment of quarantine.
Oh, it's hard. My brain keeps on saying, get out of the house. Now that it's working, I am grateful that I can be a positive force in my daughter's life now. And I can see things a little more clearly than I used to.
That's
We
awesome.
live together, by the way.
Yeah, I think I knew that. I think I knew that. All right. Number two, tell us something new you tried this quarantine.
Just like everybody else, I'm baking bread now.
I haven't. I think I saw that on social media somewhere. But what kind of bread are you baking?
Um, I'm making artisan bread, white bread, um, banana bread. My bananas are going bad, so it's time for banana bread. Yeah.
Nice. Okay, last question. What's the first thing you will do once the stay-at-home orders are lifted?
Seriously, I'm going to get a haircut
Good one.
because it took a lot of hairspray to get this where it is tonight.
All right, so listen, I am so thankful for you joining us and kind of telling your story about TMS. I personally, for me, it's so tough to kind of be the lone voice out there trying to tell everyone how great this is. So to actually have someone who experienced it to come and say it, I really appreciate it. Hang on for 1 second because we got some questions. I want to see if anyone had a specific question for you. I think everyone is just saying right now that they really are happy that you were able to join us, and a lot of good things for you. Joshua says you're so brave. Um, Tiffany Johns. Oh, I guess that's your daughter. Maybe she said.
That is my
TMS
daughter.
my mom. Yeah, she's on here posting some comments. So awesome. All right, cool. All right,
I
Terry.
just want to say thanks for letting me tell my story because I just think it's so important that other people know about this.
Yeah, that's really all it takes. Someone can, Google everything and read everything that they can,
Mm-hmm.
but actually hearing someone say, "Hey, I went through this. I was in the same spot you're in, and now look at where I am," really
Yep,
could be that last thing that pushes someone to try something that, really could have a positive effect for them.
it worked.
Okay. Um, I think, oh, they do have someone asked a quick question. Rachel asked a question. What depression treatment were you under? Had you ever witnessed signs of improvements with other treatments?
Um, I shied away from a lot of medications because I had a daughter that died of a drug overdose. So I know what it can do to my brain, and I just didn't want to mess with my brain chemistry. I was taking 2 medications. I tried a lot of therapy. I actually didn't realize how bad my agoraphobia was till I tried to take a trip by myself, and it was horrible. But I just kept on trying therapy and was only on a few medications, but I just shied away from that. And maybe that's why I had such positive response and quickly.
Yeah. Yeah. Someone asked, Lauren asked, can I drive myself to TMS treatment every day? Yes. I mean, you didn't notice any problem.
No, it was actually very joyful to drive myself because I didn't have the anxiety while driving. That's when I first realized it was working, was driving
It's funny.
home.
We've had several patients come to treatment who had to be driven by family members because they were so agoraphobic they couldn't drive, and by the end of treatment, they're driving themselves. So,
Right.
I mean, there's concrete improvements with the
Uh-huh.
treatment for sure. So, okay, I think we're good here. So, thanks for joining us. Thanks again for telling your story, Terry.
Yep.
And
You're welcome.
we'll stay in touch like we have been.
Absolutely. Bye,
Okay.
Dr.
All right.
Upshaw.
Bye. Okay, so I want to thank everyone for joining us today. If you're finding these YouTube lives helpful, we're going to continue to try to produce some helpful things for you guys. Again, we found this very useful to connect to our patients, to connect to the community, to try to get the word out for all things mental health, but especially TMS treatment. And so if you're finding these helpful, please continue to tune in. We're going to continue to have good guests. We're going to find some good things to talk about here and answer your questions. So actually today's YouTube live was kind of inspired by some questions that we've been getting a lot about TMS, kind of some of the basics. So again, I apologize for the technical difficulties tonight. Kind of threw me off a little bit with what I had prepared. Hopefully we got the gist of it. Obviously, Terry sharing her story was amazing, and we thank her again for that. And if you guys like this, hit the subscribe button, like the videos, and we'll continue to try to get some information to you guys. All right. Thanks for tuning in. That's it for now.